Choosing a health plan is one of the most important decisions you can make, especially now. So we have one of the best-selling authors known as the Budgetnista, Tiffany Aliche. Thanks for joining us today.
Thank you for having me, Angela.
Okay, so now here we are during this pandemic. You just recently you're joining with Aflac to share a survey about how consumers are spending more time researching healthcare today. Can you share some of those results?
Correct. So see, Angela, if you don't have comprehensive health care and you get sick, things like your hospital bill, your doctor bill can really devastate your family's finances. So it's really important to choose a plan that is going to allow you to focus on getting better, not just paying bills.
Absolutely. So how is the pandemic affecting open enrollment in healthcare?
The 2020 Aflac Workforces Report, available at aflac.com, found that the pandemic has served as a wake-up call for nearly half of the people that they surveyed. People are realizing they're going to need to invest more time into researching the right healthcare plan to make sure that they're adequately covered.
Okay, so when we choose a healthcare plan, how can that play into our entire financial health?
It is super important because the Aflac survey found that 48% of folks admitted that they didn't have up to $1,000 set aside for out-of-pocket expenses. That means if there was an emergency, so an accident or serious illness, they would have to rely on debt and credit, which we both know is really not ideal. So benefit enrollment is really one of the most important decisions an employee can make. You really want to take the time, especially now, to also look into supplemental insurance. So things like accident, critical illness, hospital plans, because these are things that might not be covered under your healthcare insurance right now. Things that you might not think about, some costs, that out of cost expenses like groceries that you might need help with should something happen, your rent and copays.
Gosh, Tiffany, it's so true. You know, we often heard from our financial planners before this pandemic, make sure that you have 6 months set aside for a rainy day just in case. Most of us didn't really listen, maybe 2, 3 months, but it's shown that we really have to be prepared. What are some other healthcare trends in this report?
I agree, because one of the trends, to your point, is there's an anxiety about the cost of healthcare. 50% of folks that were interviewed felt like anxious about not having enough to cover healthcare. So much so that 46% shared that they had delayed medical care because of that cost. I know people who are more concerned over the cost of the doctor visit than their own symptoms.
Gosh, that's so true. So Tiffany, you know, as the Budgetnista you are, what is the #1 tip for helping us reach our financial health?
The #1 tip I have for helping you reach your financial health is to take action now. Start your budget, get your free credit report or your credit score, call your lender, call your HR department, because when you take action, it builds momentum, and momentum builds change.
That's so true. Like, pay off that one credit card, then it snowballs, right? You keep going and you keep going. Where can we go for more information, Tiffany?
For more information about the 2020 Aflac Workforces Report and supplemental insurance, you can go to aflac.com.
Tiffany, thank you so much for these great tips today.
Thank you, Angela.